Doctors of Reddit, what is the most how the frick did that happen to you case you've seen? Lady with very poorly controlled diabetes and morbidly obese came in via ED with a gaping hole on her thigh, like so deep you could put your whole fist through it. It was oozing ridiculous amount of blood, so much so she had to be transfused. Her blood levels were rock bottom. It transpires she'd accidentally cut herself when trying to wriggle into jeans. Meantime, the wound just kept getting bigger and bigger, and she attempted to just sort it by packing the wound with socks. Single worst thing I've seen. Working in the ER we had some interesting ones, but the simplest and most intriguing one I've had was a man came in complaining about chest and side pains. After a few tests to rule out heart issues, we discovered through an x-ray that the man had 19 fractures throughout his rib cage. When I asked him if he had been doing anything dangerous, he replied with nope. Just dancing. Needless to say, I'd recommend not trying to do leaping flops into the worm on repeat on concrete, which is the only way I can fathom this occurring. And no, he didn't explain what kind of dancing. Well, he sure wasn't doing the safety dance. Old paramedic here. I had a 60s male found on his hands and knees quite dead. He was positioned to receive a corn cob mounted to the door lifter on a garage door opener. The track was modified to run the length of a mattress powered by the 1-stroke 2 horsepower opener. He used the remote button to forward and reverse the lifter with a plate adapter for a large rubber corn cob. He had taken a massive heart attack. Training as an EMT, so not a doctor, but in the air. Old guy shuffles in with his girlfriend, both mid-50s. He is holding a members only jacket in front of his crotch and waddling in. We take him through tridge to the back and get him on the exam table. His scrotum was the size of a large watermelon. It hung below his knees and was easily 18 inches in diameter. Serious hernia issue. Just a big oblong mass of flesh that had overwhelmed the rest of his nethers. I think every physician in the hospital came down to consult on it. I mean everyone. Cardiologists, ENTs, etc. Everyone made an excuse to come take a look. This was clearly an issue he had been avoiding for years. The prescribed treatment, if I remember properly, was to Kevlar reinforce his belly and shove all his intestines back up and in. They were going to transport him to a nearby hospital for the treatment, but because it was across state lines he refused to go. So he slid off the table, pulled his jeans up around his crotch, grabbed his jacket and his girlfriend and shuffled off to the bus stop. It's an image you never forgot. Closest thing I can relate it to is when Hugh Jackman is trying to carry the fishbowl between his legs in The Prestige. The human capacity to deny the undeniable is amazing. As a radiologist, I've seen an 80-pound ovarian tumor, a hand-sized facial malignancy neglected until it eroded an underlying artery, numerous neglected breast cancers, eroding through the skin. People will refuse to see what they really don't want to see. Doctor friend told me of a man with a flower stalk stuck up his dong. He was trying to give his GF a birthday surprise. Unfortunately, flower stalks have little angled hairs on them which make them easy to push in but impossible to take out. Saw a guy who had a pretty blunt machete lodge perfectly across the middle of his skull, but the angle was unusual and it was like perfectly along, so that caught my attention. Turned out the guy had, unsuccessfully, tried to murder his wife with the machete and later regretted it, so he hit himself in the head with it. He held it with his hand, sharp side front, and gave himself a whack perfectly in the middle of his skull. Thankfully the machete barely made it into the skull, and since it was along the middle it didn't touch any brain tissue. Work in a burn center. For 3 months in a row we had 3 different people come in because they tried to commit suicide by setting themselves on fire with gasoline. I cannot imagine what brings someone to that point to think that's a good way to go out. Those burning monks, protesting the war in Vietnam, come to mind. Not a freaking peep. While they sat there cross-legged. I don't know that I understand human. I have an amazing how the frick did that happen to you story. End of nursing school, did the rotation internship in the large urban hospital. Get a call that the hello is bringing in a 17-year-old with a severe spinal injury. Call in the specialty surgeons and they get to work on this kid. He has C3 through C5 fractures from a diving injury. Docs work on him 4 hours with very little hope that he will regain anything below the neck. Once the surgery is over we are all exhausted, but the surgeon wants to see what will happen if we wake him up. With respiratory standing by we bring him out of anesthesia. He starts breathing on his own. He opens his eyes and responds to his name. Holy crap, awesome. For some reason I was near his hand. I saw small movement. I said nothing. I grabbed his hand and squeezed. He squeezed me back. Holy freaking crap. Mind you, I'm just a nursing student, but I yelled the surgeon's name and said he just squeezed my hand. Surgeon called bulls until he saw the kid raise his arm. The entire hall was silent. This kid should have been a quad for life, but by some miracle he was moving. The feeling of seeing that kid's arm move is something that I will never forget. I tried to keep track of his progress, but the last I heard he was killing it at physical therapy and had regained almost total control of his upper body. Just last week I had a guy over 400 pounds, BMI 60. He was a hoarder and kept getting cellulitis in his legs because his house was so cluttered. He kept hitting his legs into things and getting cuts and infections. When he came in, we had to remove his socks with scissors because he hadn't taken them off in over 3 months. His socks had embedded into his skin and somehow become one. I didn't learn in medical school how that happens. I once had a patient that got pregnant despite never having fricked. She had severe vaginismus and was not able to ever have anything go into her fanny, but her significant other ejaculated onto her and apparently one little swimmer found an egg. Had a lady come to the morgue in pieces for several days. She had fallen off a catwalk thing into an industrial fan that had no guards due to a cleaning being performed on that area in a factory. They were having trouble finding all of her. It wasn't explained to me until 3 days after the first piece showed up, so I thought there was a serial killer out there for a bit. I didn't see morgue the first time I read that and was very confused. Back when I was a medical student on a urology rotation, we had a guy come in after butterflying his dong with a fillet knife. This occurred after consuming a lot of C. It was his 3rd time doing it, all 3 in a fit of C-induced psychosis. You'd think he'd steer clear of the old Bolivian marching powder after the first 2 times. Butterflying his dong with a fillet knife. I don't know what that means, but holy crap, do I not want to know. Nurse here. Had a patient come in due to pain in her chest 4 months after having a mastectomy. When we changed her dressings, the site was so infected that I could see her lung inflating when she took a breath. She died a week later. Still don't know why she didn't come in earlier. Bro, I can't even begin to imagine how painful that had to be. Heartbreaking that she died. Had a lady in the who had a celeb in her rectum. She was extremely embarrassed but came to the department for removal. We took an x-ray. She had pooped it out and didn't even feel it come out. Got a bill and mortified. Only put toys with a flared end up the shit-chewed cavity to prevent this exact situation. A PA I work with saw this patient with an external fixator. Normally these are odds and screws outside the body holding a fracture stable until swelling or what have you goes down so they can operate and internally fix the fracture. They're normally on for a few days. Cut to this guy's office where a patient walks in one day with an X-fix on his leg that has been there for 3 freaking years. The guy lived a normal life and just thought it was the way they fixed legs. How he never got an infection I'll never understand. I've heard surgeons refer to the trauma unit as relentlessly working directly against natural selection. Use your imagination. They've seen a lot of Darwin Award candidates. Not a doctor, post-surgical nurse. Had a guy with necrotizing fasciitis, flesh-eating bacteria, on his scrotum. Had a wound vac that kept leaking. I had to change it. Was not pretty. By the end of it we were both traumatized. I'll never forget the agony that poor guy had to go through. But, on a good note, he healed up eventually. This is often called Fernie's gangrene, and as you may imagine, it's pretty bad. Work in the ED as a medical student. Had a guy the other day who let a leg infection get worse for years, and when he finally came in his infected leg was at least 4 times the size of the other one and was draining copious amounts of foul smelling pus. If the infection had been seen earlier, he would have just needed antibiotics. Because he waited so long, he's going to lose the leg, if not his life. Not me, but a nurse friend. Guy comes in complaining of pain sitting down. Pain in his rectal area. She goes to take a look and this man's anus is so infected it was almost gangrenous. The infection wasn't just around the anus. It had traveled inches deep into his body, literally using pus. One nurse had to excuse herself and almost passed out due to the smell. I was told, but no idea what caused it or whatever happened to the poor guy. Probably injecting drugs Swamp of Dagobah style. 70-year-old guy came into the VA clinic for a bad cough and admitted due to temp of 104F. He was mine and I found lumps on his neck on exam. He had tuberculosis, scrofula. So, why does he have TB in the US? We do HIV test and he's been with some prostitutes. He also developed some other complications and was finally discharged after 4 weeks. Poor guy got a cough from fricking. My cousin is a paramedic in a large city and had these stories. 1. Victim is a powerlifter with a home gym. Tries to squat too much weight, and on the upward push herniates his sphincter. When he got there the man had 6-8 inches of his small intestine coming out of his butt. Apparently the medical street slang for this is red socking yourself. 2. Victim is a man with a flashing fetish. Late in the night, he walks to a 7-Eleven, waits until the female cashier turns her back, and then opens his jacket so his erect member is lying on the glass countertop by the register. In a panic, the cashier grabs the first thing she could find, a can of tomato soup, and in an adrenaline rage brings the can down on his erect dong. He said this apparently almost entirely severs the man's dong, which fully erect is moving a lot of blood through it. He said the man nearly bled to death and the 7-Eleven looked like a murder scene when they arrived. 3. Victim is a morbidly obese man, completely naked, masturbating with a can of soup lubed with honey he is shoving up his butt. In the process, he stimulates his prostate nerve too much, has a heart attack, and dies. That's what he responded to, a naked, sweaty, morbidly obese corpse with a honey lubed can of soup halfway up his butt. He mentions they had to make efforts to keep the victim's small dog out of the room, as the dog was quite drawn to the honey. Please don't think about doing M's unless you're willing to see some truly horrifying crap. Not a doctor but former psychiatric nurse. I have seen all manner of weird and wonderful things, yet the most perplexing was a young girl we nursed in PICU with history of pica. When we took her for x-rays, due to her complaining her stomach was hurting, we found a belt buckle, a full-size spoon and butter knife as well as an assortment of batteries. As far as I recall, as it was some time ago now, they had to operate immediately to remove, and again if I recall correctly it was the batteries they were most concerned about, as if one exploded started leaking it would have caused irreparable damage. I have never seen a set of x-rays like it, and seeing was believing. Incredible how the heck she managed to get them in there, but never underestimate the willpower of psychosis. Disclaimer, I'm not a doctor, I'm a paramedic. My first week on my internship, we responded to a fairly rural gas station for a male patient complaining of an altered level of consciousness. When we arrived on scene, the patient was sitting in a chair in the dining area of the gas station. I introduced myself to the patient and was crouched on the floor in front of him trying to get him to answer my questions, but he wasn't really giving me much. I looked down and noticed a small white worm making its way across the floor. I thought, well, crap, sir. I said, I'm going to remove your shoe. And I did. As I did so, a cascade of maggots tumbled onto the floor. The entire sole of his foot was being eaten away by maggots. The patient was completely unable to tell me about his medical history or how his foot had come to be a buffet for corpse fauna. I double bagged his shoe, along with several dozen maggots, because I didn't know what else to do with it. His blood sugar was fine and he didn't appear to have a history of diabetes, and he had full sensation in the parts of his feet that weren't being chewed on. I still wonder about that guy. The only thing the patient was able to tell me was that he lived 2 states away and thought he was still in that state. The most alarming thing to me about the whole situation was that he had gotten in his truck and driven 2 states over with no memory of doing so. More of a how did you let this get this bad and not come in sooner? Patient came in Friday at 12:30. It's always Friday afternoon when they come in. Because why wouldn't you come in during the week before the busy Friday rush? Because suddenly you realize you don't want to go the weekend with something happening. So he comes into my clinic saying his eye's hurting. It's been hurting for a few months. Feels like pressure on the right side behind his eye, and he's had a headache on that side that has been worsening. His vision is also worse than it used to be and things seem dimmer. My staff member remembered what happened a few months ago with a similar situation. Turned out to be angle closure glaucoma that needed surgery like 2 weeks ago. So she comes to me and asks me if I can see the sky because he's in pain and scared and doesn't want to wait the entire weekend to be seen somewhere else on Monday. Okay, sure. I take him back and we go through everything. Vision is reduced. He's seeing distortions in letters, but everything looks fine from the outside. I dilate his eyes and take a look in his right eye. Right smack in the middle of his central vision is a huge elevated white lesion. We take some pictures and scans. I had to sit down with him and have a hard talk. Why did you wait so long? This has been going on for 3-4 months now. He's got history with colon cancer from a few years ago. I had to tell him it's very likely a choroidal melanoma. I sent him off to a specialist. I don't know if he'll lose his eye yet. I suspect he will. If he's lucky he'll live and just have to deal with having only one eye. If he's extremely blessed and lucky it will be treatable and he won't lose the eye. Good story, but ugh, I have such sensitive eyes. Reading that has my eyes watering at the thought of it. My mother is an emergency nurse and a while back a 90-year-old woman came into the department complaining of pain in her leg below the knee. After an examination my mother suggested an x-ray. X-ray comes back and it turns out the leg had been broken several months prior, snapped clean across both the tibia and fibula, and she had somehow ignored what must have been excruciating pain and continued about her life, and then the bones had healed but not straight. The top of the bones were to the left and about 2 inches below where they were supposed to be, and they had fused to the lower parts at the side like that. In the end there is nothing that could realistically be done, as to sort the leg out would require breaking it. Dang. I didn't know human bodies could do that. I'm not a doc but a medical technician. Still in college but you see some crap nevertheless. There was a guy who had a car accident damaging his cervical spine. Our occipital surgeon did an amazing job, so after a long process of recovery the man was able to walk using only a cane. Another problem he had was some neurologic muscle illness. Not sure if myasthenia gravis or something else, which made it hard for him to do any fine motor movements. Although he had all these health issues, the guy insisted that he is independent, so he did all of his daily activities on his own. The problem occurred when he went to his beach house on a vacation and went to take a bath. He lied into the tub and turned the water on. Then he turned on the hot water and realized that the faucet iced the same as he had back at home, and because of his motor skills being bad he didn't manage to turn the hot water off. Result: 2-3 degree burns on the left side of his body, from head to toe as he was laying on his side. He almost cooked himself to death. I don't even get in the tub in my own house without testing the water first. It's just not comfortable, even because you're sort of wet and cold. My doctor was very confused how 9-year-old me managed to completely rip my big toe's nail out at 3 AM. I tripped running down the hallway on the way back from the toilet, cause you know monsters, and slid along my carpeted hallway. The friction between my toe and the carpet ripped it out. OMG. I think I just shaved 3 years off my life by reading this. A very tame example, but here's one. Mum, an ex-nurse, told me one day a patient came in who had basically no social interaction whatsoever, so he looked like a complete mess, with hair nearly down to his hips. As the nurses cleaned him up they noticed his hair was quite thick around his head, and they couldn't cut through it. It turned out the guy had been wearing a beanie for the last 10 years and his hair had just grown through it and over it. Wow, I wish there were pictures on this one. Nurse here. A girl came into the OR with a retained bottle cap over her cervix. That had been there 2 years. 2 years. Sounds like at-home contraception gone wrong. I'm an OPA. Patient tried to kill themselves by slitting left wrist. Patient was unsuccessful, as they missed the deep anatomy and arteries, but certainly cut bad enough to cause a heck of an infection. Fast forward a few months without seeking medical treatment and the necrosis had eaten up the vast majority of the forearm, exposing a large amount of bone and tendon. When I asked if it hurt, patient used an index finger, jabbed the exposed distal radius and said, "Right here, shudder." There was a patient in the hospital where I work, and one of his legs had gotten so infected it split open and maggots were living inside of the open wound, and he called them his pets. That sounds like a good reason to request a psych eval. Doctor, multiple incredibly advanced cancers, mostly breast, head and neck, cervix, and anal. 1 or 2 vulva cancers that was particularly bad as well. Worst non-cancer case was during intern year. Morbidly obese man comes through ED. So large he had to have 2 bariatric beds pushed together. He wasn't to be my patient, but he had a lot of anxiety and embarrassment with female doctors. For some reason we just had a connection. I really felt like he just needed to talk. Talked about his situation, home life, all of it. He had this calm and peace about him despite his health. He passed away 2 days later. At first it was hard to comprehend how life would come to that, yet in the end I understood. I'm sorry man, I wish things had been better. Frick, I'm glad I'm getting help. I just hit 500 this year and I refuse to go any freaking higher. I'm not dying in a hospital bed at 600 pounds. See? My neighbor was an ex-emergency room nurse. Whenever we would ask her about strange cases, most answers were you don't want to know. The only story I have is really strange. One day, a morbidly obese woman rolls into the emergency room. Her legs couldn't support her weight anymore, and complains about mild stomach pain. After letting several people with mild ailments get treated before her, she sits up and rolls to the staff-only water cooler behind the counter. My neighbor tells her about how the cooler is only for staff, and she starts to go away. Midway, she stops and from under her skirt a baby falls on the floor. Apparently this woman was pregnant and didn't notice because of her weight. How the heck didn't she feel giving the excruciating pain of giving birth? WTF. Edit. The baby lived, and apparently she just had intercourse without protection and was stupid enough to believe she wouldn't get pregnant. I'm not really sure if she kept it or not, but I'd like to think so. Doctors were surprised when little third grader me was brought in with a lacerated spleen and lungs gradually filling with fluid. I tripped and fell off of an 8-foot bridge into a creek on my dad's property, and a rather large rock caught my fall, hitting my ribcage just right. My dad thought I was just being a pea and told me to sleep it off, but 8 hours later my mom found out. They were divorced and rushed me to the hospital. Thankfully, spleens are very good at regenerating and I made a full recovery with some physical therapy. So, my top moment of how the frick did that happen was I was on my internal medicine ward's rotation. I had this guy in his late 60s come in. They told me it was an admission, but they were stupid vague. So, whatever. I go in and I notice on his left hand was this golf ball sized blood clot with a bruise that extended to his elbow. Now, I want to make sure this image is clear. There was a black purple golf ball sized oozing ball on the back of his hand. Still with me? I, like with all patients, ask what brought him to the hospital. Well, you see, I went to my psychiatrist, cause I've been having problems sleeping. I wanted a sleeping pill, you see, and I immediately stop him right there and clarify, so you are here for a sleeping pill? He says yes, so my psychiatrist didn't want to. I stop him. Say haha, no, you are here cause of your hand. What happened with your hand? He kinda ignores me, wanting to just blow it off. I refuse to let him talk to me about anything else till he tells me about his hand. Long story short, he was on a blood thinner called warfarin. There is a measure of how the blood clots called the INR. Normal people are around 1.0. People on warfarin are often aiming for a 2.03.0 INR. His was fricking 9.0, and the mother wanted to leave when I told him that. I had to put him under a legal medical hold to fix it so that he didn't turn his head too fast and have a brain bleed. By the end of his admission, he admitted to like taking all the random OTC herbal crap online cause he read it was good for him. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.